Hi guys, greetings from Better Man Clinics and welcome to Ask the Expert, the segment of the program in which actual questions from our viewers and listeners are answered by the foremost experts in the field. Today's question comes from Sal in Brooklyn, New York. Sal asks, what actually happens during prostate artery embolization when it is performed to treat BPH? In order to answer Sal's question, we turn to interventional radiologist Dr. Ari Isaacson. Here was his response.
That's a good question. Just to kind of fill out the experience, if you come see me, we do this at an outpatient center. So I'm not working at a hospital. I'm working at an outpatient center. You come in, we get an IV started on you when you come into the center here. And then we bring you back to the procedure room. We give you a little bit of IV medication to relax you. We give you a numbing shot in the groin area where we're going to put the catheter into the artery. That numbing shot is really the only thing that's painful for the whole procedure. You just feel a little bit of a sting and then it's over. After that, we insert a catheter about the width of a piece of spaghetti into the arteries. We direct it through the arteries using X-ray to show us where we're going. Every so often, we inject a little contrast dye to show us the arteries. And then we get into both sides of the prostate and inject those microscopic spheres that block off the artery. Once we've done that on both sides, we take the catheter out. We use a closure device to close up the hole in the artery that we've made. And then the patient will recover for 2 hours. So the procedural part takes about an hour or so. And that can be variable depending on how tortuous or how windy the patient's arteries are. Sometimes it can take longer than that, but typically it's about an hour. And then the patient recovers for 2 hours. And then after the 2 hours, as long as they can urinate, then they head home.